Okay, so you want to better? Test.
Is it good now?
Test. Yeah, perfect. Okay. It looks like I'm off mute and we're streaming. Okay, so let's get started. So, for the folks online, I'd like to do a quick welcome and introduction to our in-person meetup. So, good afternoon. I think I'm not going to say good afternoon, good morning, all that good stuff. I'm just going to say good afternoon because it's good afternoon in Boston. So thank you for joining us on the stream. And so yeah, Boston Healthcare Cloud AI community, thanks for returning. If you're a return guest, as you know, we have our monthly meetup the last Wednesday of every month. And then this month is a little bit unique, or actually I should say next month, the first week of June, because we're having our our second full day event here at the local Microsoft offices, and there'll be details in the description and links to that for the folks online. And so, just a little bit about who we are: the Boston Healthcare Cloud and AI community, sponsored by Real Activity. Also, Microsoft is essentially sponsors us with the space, and so we're grateful for that as well. And essentially, our goal with this group is really just to spur interest in healthcare and clinical informatics and technology. And so it's worth noting that my company, Real Activity, we actually do a lot with events, especially healthcare events. And those are core to our business. You know, we go out, we meet the community, we learn what's going on, et cetera. But then there are these events, and we view these as something that different that we do as sort of our part of giving back, of being a good sort of corporate citizen, if you will. And I just want to start to point that out a little bit more, because a lot of times it's easy to think that, oh, you know, the motive for this is, oh, it's all business and we just want to get leads, etc. Now, don't get me wrong. Of course, it's great to get your name out there, and that's wonderful, right, to be associated with something like this. But to be clear, this is something that we're proud of, that we do to give back to the community. And, you know, we do a lot of work events too, you know, but we consider these sort of, again, giving back to the Microsoft community, if you will. And so that's a little bit about us. I think if I had to share one more thing, it would be our mission. And essentially, we've sort of come together around focusing on bringing together graduate students with leaders in healthcare technology and bringing great content. And really, that's it. So far, that's our philosophy, like letting the magic sort of happen when the people get in the rooms or they get to the events. And so we are excited to continue to build on that next year. And so please follow along. Again, there'll be links in all of the descriptions so that you can keep up with our announcements and our events. And so with that said, are you ready to, I'll turn it over to you now. Oh, look at this. So you have the remote. I thought you were going to have to come all the way back down. Okay, thanks.
So today we'll discuss about how we can enhance the service delivery by looking to overcoming the challenges of the interoperability challenges, so that the delivery will be more accurate, faster in the area sectors of like healthcare and banking. So today. Uh, Yeah. So this is the basically the agenda for today. So we'll discuss about what are the challenges while dealing with the healthcare and banking systems in the sense of the interoperability. Um, so how we can overcome that, and what is the AI's role in the healthcare, handling the healthcare interoperability, as well as in banking sector also. Apart from that, we'll see the benefits of AI enabled platforms to handle the interoperability. Apart from the what are the challenges and considerations while dealing with those different situations, and what is the future outlook of the for these advanced systems to handle those, and we'll then share about the conclusions about the topic.
Nilesh, sorry, do you mind if I do next on your slides? Because those are forwarding, but these are not. So. Thank you. Perfect. Okay. Okay. Yeah, there you go.
Maybe,
Okay, it's okay. I'll give it back to you. Go ahead. Yeah.
I guess what slides?
Did I mess it up?
Yeah, it's okay.
In one slide
Next
back.
slide, yeah, one slide back.
Yep.
No, one more.
Oh, you want me to go back?
Yeah.
Yeah, back. Yeah. Hi.
I'm so sorry. Thank you for your patience.
Sorry. So, like we know, right, in in current like healthcare or banking systems, the digitalization is playing a major role. Like if we say like healthcare electronic health record, for example, system. So it's also playing a major role in the current healthcare systems. Apart from that, the monitoring, the remote patient monitoring systems, which also plays an important role in current days. So, like if you say like these kind of like AI powered diagnostics and all, so playing major roles, contributing the major things in the currently healthcare and the banking sectors. So where basically what we can say is like their aim is to improve the digitalization's aim is to improve the patient's outcomes, reduce the cost, enhance the accessibility. So that provide the more and more accurate delivery, faster delivery is the major goal. Similarly, in banking sectors also, like the digitalization comes into the picture, like a digital banking, mobile payment systems are there, fraud detection systems, secure the transactions. So multiple platforms, basically banks, what bank is doing, offering the customers good real services through the doing the digitalizations of their platforms. But in sense of doing the digitalizations, so when there are different systems, and then different systems wants to communicate with each other. So there where like interoperability basically between providing the good service or excellent service basically comes into the picture, because the when the different systems are there, the major need is to transfer the data accurately. The data should be in the timely manner between the different systems. It should adopt the different formats between the different systems. So in that sense, like suppose in that case, basically when the data we need to available whatever and whenever. So that is the need of the current current healthcare or banking sectors need for the different systems. But why we need that? Because in that scenario, basically, like for example, if we wanted to do the diagnosis, to accelerate the diagnosis or any patient's treatment, basically, if you want to improve the treatment faster, accurate, do the coordinations, reduce the errors between the different systems, maybe a medical system, maybe a banking finance system, because it is more finance system. So in those areas, basically, we need to interact with the different systems, transfer the data between the different systems. So that is the need of the current interoperability between the different systems for this in the complex scenario, as well as simple scenarios also that is the need. But so to solve those areas, so solve those issues, basically AI services, API can help us can different areas. Like for example, in automatic standardization areas, when we optimize the data transferring process or coordination process or standardization process, basically AI can provide their algorithms, and those algorithms basically like used to normalize the data, or reconstruct data in different formats, data in the different format, and then so by dealing all those things, the manual efforts of those manipulating those data can be done with the AI algorithm. So apart from that, this another stuff is like enhancing the security and the compliance. So basically, the security and the compliance is the major need. Like for example, healthcare systems, there is the data is more sensitive. In banking also, data needs to be more sensitive and should be accurate. So should be couple of things keeping in mind the the AI-based monitoring systems are available, or detect the malicious activities or malicious activities or any anomalies can be detected with the help of AI. So these platforms can AI can provide the security because privacy and security of those healthcare data as well as the banking sector data is very important. So AI can help on those. AI can help on. So overall, I can say like so overall introduce like AI APIs or microservice, it can help us like make the system more faster, secure, more and can provide custom-oriented solutions, more comfortable solutions in the handling the different systems data or interacting with the different data at the same time. But dealing with that, like there are a couple of challenges when we deal with complex systems, in and private communities. There are lot of challenges. So couple of challenges are like a fragmented data. So data is scattered across different systems, and this data is and when there is a data scattered across the different systems and collected across those data for and we generate required data for the healthcare systems or any other systems is one of the challenges. Is one of the challenges difference when dealing with the standardization. Another the data standardization system, the data patient records from one of the another hospital or any other details. So those any other data, there is no standardization. So when they come to collect those data and try to process those data for example, like clinical needs, for example, technical needs to understand patient diagnosis or anything. In that scenario, standardization data is another challenge when the systems comes under the complex comes under the complex. Apart from that, the concern another concern is the data concern. So data is processing. So data is most of the data when we handle most of those data when we handle the manually or handle there is a concern of data security. There is a concern that data another that data security concerns data security concerns any system. So it may be any patient's data around patient's data or like financial data, like financial data we need to keep it protected. So that is another protected. So overall, that is another see. Overall, those data, handling different data, making those data available on the making those data available on the point of decision making systems. Those that decision making time delays because of the different system has their own delays. So all basically coordinating those data is another challenge in the multiple systems diagnosis scenario. So now like some systems are in cloud, like some systems are in cloud, some systems are in and all those really those data without giving the less latency and that is the challenging when that is the currently challenging when dealing with the data because yeah, so we'll see. Yeah, so how we see. Yeah, so how to basically those how to handle basically those kind of these challenges are when we go with the manual processing the picture bigger for those becomes for more in those challenges. But more if you take advantage of technology, technology, then APIs and services, APIs and microservices. We can handle those kind of challenges in a very very so that better accuracy and better accuracy we can say with faster we can say faster accurate way. For example, I can go with when the system is data is scattered, data is scattered across, we want to collect those data and we want to and process those data. In that scenario, basically the ones in that we can use one in case of we can use that. So in case of APIs can provide some standard APIs, that standard APIs can provide us that standard interact with data, interact with standard format. So standard format. So still no data is delivered. Still we can use the APIs to provide data as well as required data, as well as with the help of those data, like conversion of those data, mapping of the data with the help of data, so that is the manual efforts can reduce, and then the data problem of the data fragmentation is will become more accurate and of the faster while dealing with the different. Apart from that is standard. Apart from we saw is another standardized. We saw another problem is the standardization in the data. So when the data like the different format, or like file HL or those kind of standard HL, those kind of APIs can handle basically. APIs when we deal with those, so API we can API is the API is standard format data with the different format because APIs can work with the rest, and the rest basically is and the rest basically clients different handle different areas, the client areas, different the client environments like you can say Windows or Java, Linux or Java platform. So APIs can help us to handle those. These are the lightweight. So basically, what can help us to use like those like fire format or HL7 kind of format, where basically AI can in that area, so AI can help to do some standardization based on the algorithm, and once the standardization is done, like for example, implementing the file or HL7 AI or HL7 and over the period of time, AI can more accurate, more precise by more accurate historical data and making historical data format, making more accurate format. Suppose any errors or anything comes up, so AI algorithm can read those data and based on the those issues or challenges, they can challenge those standardization properly to deliver that data in the third is like security. Third is like this is another issue with the data. This is another issue with the data privacy. So that also basically that also a bigger chunk of data or bigger chunk of basically we can use like microservices. We can make like a smaller data, and microservices has the security mechanism like you can security optical systems where basically those systems where we can protect the internal microservices, the data which microservices can use. API has also their own authentication and authorization ways like OV and all. So those platforms can provide us to do the authorization with the user or system, so that the security can be reduced and reduce this and when with the different system can protect with the different system. Apart from that, AI. Apart from go with the AI, basically, so AI can help with those areas. AI can also help in those areas. So that we can monitor any errors or like anything in the because of the security or privacy. Here the AI can detect and then we can detect and then we can like based on the AI, based on the AI. Apart from that, when we want complex or any system from any system from the like bigger system from only then that basically microservices because API because the API when we launch it with logic little bit bigger complex data can help us. API So can help those data like a microservices with the help of APIs. Basically, AI can integrate them to make the complex or rigid system very based on the as per the need. Like for example, if you wanted to data is growing and the challenges are growing, so growing need can be handled using the AI for the APIs and microservices, so that whenever legacy system you wanted to use the leverage the legacy system data with the inbuilt systems or your built-in versions of the APIs or microservices, those kind of integration can be handled by AI, and AI can coordinate with different systems. Whenever the new system is built, whenever the new system is built, AI the data as per their new format for the complex format for the complex like that. So the another challenge for the real-time data sharing. So when we share the data, so when we sometimes share the challenge is sometimes we want data to be available as data as per the requirement. So there should not be a delay. Those kind of basically AI, those kind of AI has a predictive analytics, capabilities. So predictive analytics, either there are couple of inbuilt we can use or custom analytics we can build custom so that the real-time sharing so that complex systems will without less delay. So delay will be no more delays. So delay will be no more. That will help us to real-time sharing data difficult with the AI. Apart from that, if we go with the quality or consistency, because whenever we deal with this kind of systems, there is always a issue with the data. There is always because one system expect the data into one format from the another, and while dealing mapping with those systems or dealing those systems basically has a challenge. And basically when the data changes, this challenge grows over the period of time. So in that case, basically the AI is the basically good candidate to handle those because AI can provide us the data validation, can provide us data the cleaning of the data, because sometimes the two different systems in the different data that may not be as per data required. So the cleaning of those data, so the cleaning of those data, AI does data based on the historical data. It can read the historical data, and based on historical data, it can help out to validate and to validate and so that data quality consistency we can handle with the help of AI algorithms. With the help of AI algorithms. So like that. So like that. So the AI, APIs and microservices, the AI, APIs and microservices can contribute handling the challenges of the handling the interoperability challenges while sharing the interoperability challenges while sharing the AI. So it has a major role. It has a major role. For example, if you say like electronics, so this is health record. So this is another digital that will be separated. That can be managed by AI. So AI has like patients has the healthcare data, PH data, and collects the patient's data, and like different format, different format, that can be sources, that data can be managed by AI. Because AI has algorithms like unstructured format, from the unstructured format like node, image, and provide that data and provide that EHR input to the EHR. One of the that is one of the algorithm system nowadays manage those kind of EHR manage kind of EHR. One of the case study one of the case study come across clinical support AI model where which is basically AI model where basically what the system is basically what they are doing. They are AI algorithms they are using and they try to standardize the health data across the different providers. So where basically So where basically due to that, the patient comes up. For example, the symptoms. For example, nowadays symptoms after 6 months or nowadays all those 6 months or 1 year, all those data basically AI can gather and based on the complexity and based on the complexity or anything customer feels or anything decisions they want to feel about they want to get about anything that medications or anything that basically can support us based on the data can build up based on the different
Tell us how they're doing out there. I'm curious.
Tell us
to
how
the
they're doing
video.
out there. I'm curious.
basically the AI can provide the help. AI can provide analyze those data and analyze on that basically and help us to take the decisions. So AI has nowadays contributed majorly in the decision system, majorly based on those kind of your data which shared from the different. What I feel is like overall like the health enrollment basically healthcare enrollment. Being the AI, making the healthcare system more faster and like accurate and like helpful for the patients, helpful for the patient, delivering the product to the patient on time and very with the tracking space. With the tracking
Is it
space.
question? Is it it
Is
seems
it,
like you do a
it seems
lot in
like
this
you
space. I'm just
do a lot
wondering,
in this space.
have you
I'm just wondering,
have you seen
um,
anybody
seen
using
anybody using
AI and Fire with
AI
OpenEHR yet? So
OpenEHR
OpenEHR is a open source
OpenEHR is
healthcare
a
record. It's a global initiative. There's a lot of countries and nation states that are using it, and then smaller hospitals in the U.S. and it's open source. And we're part of that group. We're on the committee. And one of the things I'm just curious about is the community and when they're going to start infusing AI into this, right? Because you like Microsoft and nuance, you guys have done a good job at nuance, right? And so it's almost like I feel like somebody like this needs to do the same thing with the open source EHR, you know, the electronic health, you know. And so that's what I'm asking. So have you heard of open EHR, any initiatives like that? For the
Fire
integration.
and AI combinations currently we are using.
Yeah.
So yeah.
And OpenEHR supports Fire, so I assume it would be fine. Like interoperability shouldn't be an issue.
Interoperability. Is it so the resistance is between the well established versus
Yeah, but in all fairness, I don't know that resistance is the right word, because I think that there's a lot of needs in healthcare, especially if you look at globally, right? So I think in the U.S. the conversation is not quite as complex, most just because we've been consolidated into about a handful of bigger players, right? You've got Cerner, Allscripts, GE, etc. But you know, especially smaller nation states. Like I was said, I've been visiting Malaysia on a regular basis the last 3 years and doing like an executive summit talking about this type of stuff. And they've just invested about, I think it was like 500 million or something like that. But for them, it was really important because at that time, Microsoft didn't have a data center in Malaysia, and neither did Google. They were both building one, and now they have finished them. So they finished their data centers in the past few years, and it's there. But they wanted to be careful about making a decision that wasn't cloud agnostic because they didn't know what cloud was, you know. So that's why they went with the OpenEHR. And of course, there's a little bit of a money issue, right? Because of money issue, it's very less implemented. So that's why I was asking, because it's a great topic, interoperability, and that's really what. And by the way, I encourage anybody to look into that group. It's a great, fun little side thing. That just, I mean, again, it's open source electronic health record. So if I had more time, I would love to take our product that we've built on the Microsoft stack and see if we can integrate it. It's just a time thing. We just don't have time. Right. So yeah, thanks for letting me share. I just was It's open EHR. Yeah. Microsoft. I'm sure Microsoft is a supporter.
Microsoft is a supporter.
Yeah. It's open source EHR. It's open source EHR. And it's just like they have the model where it's like open EHR, but then companies take that and they commercialize it. So there are some commercial products for open EHR as well, but it's open source, and there's a group that controls that. But there are some commercial open EHR players as well.
There was a five-person into interoperability between healthcare systems, and the outcome was there's no technical interoperability.
Yeah.
What it really is just keeping silos and medical difficult to enable patients to be locked into a medical system.
Yeah, no, I agree. I think that's although it's noting the nuance there, because you're spot on and you're absolutely right. I view that as like another like interoperability issue, right? Because so when I'm having this conversation with friends abroad, they'll say, "Hey, what's up with your healthcare system?" Blah blah, right? And I'll have to remind them, right? It's almost like we have 50 countries in one. Right now, get back to what Obama because when Obama did that, what they were doing, if you remember right, it was more about making the exchanges for the finance side, the payer, the payee across the 50 states, right? And don't get me wrong, you're spot on. It's super complex, but just while we're having the conversation, I'm just pointing out the nuance between the complexities, interoperability and the payer-payee level net network, and then but then at the same time, because of capitalism, the market's been eaten up just 5 companies, right, through consolidation. So it's an interesting dynamic in the U.S. because at one time you have fewer players at the top, but you have 50 states each acting like their own country. And even within the state, we all know, right? Like in Boston, there's multiple health networks. So anyway, I'll stop. I could go on and on.
So I had a situation where I went to Mount Auburn Hospital and they're on Epic, right? And Burlington Lake over here became part of that network. Burlington was on Burlington, and I went over to Burlington for some. And I went to Burlington, they had no access. They had just been, even though and they were on the same network, and they could access the Epic system, the Mount Auburn system. The Mount Auburn was going to take a year, and they said to integrate.
Probably. Yeah, that's why it's such a great talk, and that's why we're excited to have Nilesh here, because and part of that pain is interoperability. It's exactly the stuff that we're talking about. And you're right, in Boston, it's so congested now that when I go to my hospital site, there's like 12 different portals to click on because they've consolidated so quickly. Like they've got 12 hospitals, and they haven't even had time to migrate them all. So now it's just like, okay, click your hospital, and then it brings you to that instance, and then it brings you to that the portal for that hospital. I'm sure you're seeing that too on yours.
So there's interoperability. So there's interoperability.
Exactly. Yeah. Exactly. Yeah. If everybody bought into it.
If everybody bought into it. Problem is everybody has to buy in, right? That's why it's smaller nations, the smaller countries.
You have one is direct systems, one is interoperability, but then you also have between systems. Let's say you have the concern system. Let's say you have the whole. Then you have mapping by HL7 is supposed to be solved by HL7. I suspect has not been still solved by the significant issue on how you communicate. How you map the data.
But I would say, to be fair to them, I would the core data sets have gotten pretty good, pretty standardized. Like, what is a patient? What is an appointment? What is a
clinical stuff.
There's a spectrum for sure.
Especially this system has unstructured data, and that system has unstructured data. But the unstructured data is still structured. The unstructured data is filled with unstructured data. this stuff from us, and those probably don't have to, and there's no obvious unique correct way to do it, so.
And speaking of interop issues and selecting the medical facility, like I'll give my example. I have a couple of health conditions. And I go to each of the specialty. I go to each hospital or doctor hospital to seek the treatment. But I made a decision to go under one roof, by which my PCP, can connect to all those different doctors' portals and read through all the data after my so that way at least my PCP can see my data from cardiologist, data from my diabetic hospital.
But how crazy is that? Because if you think about it, Boston is supposed to be the healthcare hub of the world. Like this is the best of the best right here. Like what we're talking about, it doesn't get any better. And we all know that. And we all know that that's scary. And that's scary, right? And that we know that's not true. There's some great work being done in Singapore, Saudi Arabia, Tokyo, different places, Canada even, right? Malaysia started. I probably do because I've been to a couple of hospitals there. I've been to a couple. Oh, yeah, sure. Oh,
everything in 4 hours.
Yeah,
I'm sure the dogs.
I'm sure.
Good dogs. My sister did it.
Yeah.
My sister did it.
If you want to see the best technology, if you want to see the best animals, look at some of the technology.
They get better than they
It's not issued by insurance. The rich will pay out of pocket. People pay out of pocket. So the whole insurance stuff that and also is not subject to the same. Also, that it's not subject to
right, exactly.
Regulations.
Right.
Like so, the one that will rich people, the one will rich people, and get really really cutting edge technology.
I'm sorry. I'm sorry. That's why it happened. I said our. That's why I said we don't have to worry about it. Oh, cool. Nice. Oh, cool. Now I speak.
Sorry. Animal care center, CR.
Yes, thank you. Back to interoperability. More interoperability.
Next slide.
Yeah. Oh.
So similar. Similarly, the areas of playing major role by the banking sector, banking system. Like for example, transfer the data across the different banking institutes. Basically, the problem is there is a private problem or like privacy, data privacy. But there are regulations issues apart from the compatibility solved with all technically can be solved. So AI provide the encryption, control the access. So those kind of sharing the data, sharing the data can provide us algorithm can provide us those kind of insights in that. For example, like a fraud detection system, we can import in our AI system also. AI can help us figure it out different data patterns, their insights, what are the issues inside those data, and then over the period of time, like machine learning models can learn from these patterns and change their algorithms, upgrade their algorithms to the upcoming or new threats, and then adopt make the system much stronger. In case of the, for example, like a bank KYC do the KYC automations or anti-money laundering processes. Those kind of areas also like we can do like verification support very strong, and apart from monitoring with the monitoring system law with those changing the laws or anything. So that basically we can address with the help of AI. So we can identify and with the verification with the help of the algorithm. Apart from that, we can put for more protective systems. We can use like facial recognition, all those basic and algorithm support, and they can get over the period of time, so that we don't period of time look for the don't in the thread, look for the change in the threads, what are the changes of the systems, what are the changes like coming. One of the prospects are like case study basically the bank basically the bank needs like or any validations or any suspicious activity. Yes, this can be help out generate advanced pattern and provide the real-time validations, real-time and while doing with the real-time data exchanges also, basically the verification process can be done with the help of AI. So basically using the AI, basically the output of the AI, what the help is in the sense of reducing the delay, making the more accurate, making the more accurate the data, and dealing with the data and the spot fraud detected with the AI system. Detected with the AI system. Basically, like those areas basically like more stronger, can more stronger. Basically, use and build the basically we can build the trust by dealing with those areas and by dealing with the banking sector. So, like when we deal with AI system basically AI use there is basically data exchanging the data we can become much exchange data much faster and then reduce the delays. Then we can produce the reliable data based on different different standard different algorithms with AI can support. Security is another benefit we can gain. Then we can manage from that and then any manage like a or any and basically all the impact and basically all those impact when we do the product of automation we can reduce the cost because automation or the process is much process is much easier when using the AI and the manual work we can and the manual work so those are the benefits we can get the AI if we able to go with the AI enable. But while dealing with those, there are different there are there are compliant there are compliant issues are there like regulation and GDPR basically can do. So basically we need to consider that with the privacy issues. Apart from that, we need to consider like the high quality of data, like a high quality of data, transmitting the different messages. So the major concern. So when generate algorithms with the based on AI, so the bias is bias for is very not for the algorithm bias while taking the decision while taking and it also maintaining the transparency and it also maintaining the transparency by taking the decision between building the algorithms dealing with those shared data of different systems. And apart from that, basically, when we deal with data from the different systems, we need to build build that train the workforce, that is train the work things we need to consider. Apart from that, like, sometimes we deal with those systems, and the AI algorithms are running, and the API or microservices are running. We need to migrate these systems. We need that in fact make systems that while dealing we need to consider while dealing with those systems. So for that all basically we need to do some planning, advanced planning, advanced planning, or planning while consider those issues while dealing with those kind of algorithms. So one of the case study, case study, the medical solution basically medical solution basically built and built so what they are that so what they want in that is generate data through the atomic and data real-time context and that real-time context so that dealing with the they can more real-time data they can get more real-time data typically they use and the deep learning model to the mapping to that mapping so that like a different data comes from the HL7 fire and different format they deal with different format they deal with the training the deep learning. Apart from that, they use the NLP. So help get to get the study the unstructured data, study the unstructured data, doctors different nodes, or images, or any scan data, and they can create the structured data from that. Another apart from that, another error for the error correction detection, we use the AI tools and figure it out anomaly data or any corrupted data or anything. So that so they can figure that they can figure it out based on the AI. Based on the if you see the when you those when you use those deep learning model and the data mapping and accuracy they mapping they achieved around 90%, and they reduced that manual errors in that in the mapping error 90%. Apart from the real time they achieved like 60% reduction in the latency. So they able to data transfer resistance, data transfer resistance. Around operational cost also, the operational cost also around the total operational cost operational cost also. In clinical like decision like the decision model which they built for the health AI platform basically they able to improve that basically by 50%. And apart from the errors, whatever they monitor, like they're dealing with the systems with the help of manual efforts or their legacy systems, they basically like they are able to reduce that error up to the 85%.
Very cool. Can I ask you a quick question about this? One of the things I noticed at Build, the Microsoft event last week, is that it seems like Microsoft is all in on fine tuning this year, and they even I've heard some people call it like the year of fine tuning, and so apparently based on what they've learned in the last year or so, they just feel like that's a really great way to start customizing these applications and solutions, like the one that you're talking about here, and I'm just wondering, and so when they were doing the demos for the fine tuning, it was really amazing. Like I couldn't help but think how much that technology had improved, because I remember not too long ago doing fine tuning and it was a big deal. Like, you'd get your data set and you'd spend this huge amount of time just filling in missing data wrangling and all that. And now, and with Azure Foundry services, they're doing fine tuning almost like dragging over. And so what I'm wondering is, underneath the scenes, under the hood, I'm assuming Microsoft is doing something like this, right? With ML models, so that they're doing the hard work for you for that fine tuning, and for the end user, it's just looking like. So am I correct in connecting the dots that way, that this is essentially what
this pattern is doing here is helping automate that data wrangling, what we used to call data wrangling, right? And data cleaning up the data, etc.
Yes.
Which is an iterative process. That's what now I'm catching up with what you were saying, because you pointed that out 2 slides ago as well, right? Because it's an iterative power. You have to keep doing that, and the data changes, and so you keep building your pipeline. Yeah, that's fascinating. Cool. Okay, thank you. Yeah.
So earlier, the thought to reduce the hallucinations or to generate accuracy was use RAG or
Right.
something, or prompts
Yeah.
or similar solutions. Right?
Yeah.
But now it looks like the cost and the time to fine tune the model
Yeah.
is going down
Significantly. Yeah. They trained one, and granted, well, I think the big reason why is it doesn't take a lot of data now. Like and again, it's built and they're doing demos, so you have to do it yourself and really kick the tires, right? But what they showed is they did it looked like a reasonable training set. And I think it literally cost like $10 or something. Like they did the math on it afterwards. It wasn't a lot of money, no. And one more note, sorry to interrupt, is I actually think it's sort of an important topic because I feel so we're, as you know, an ISV building product and all that. So I feel like so we're always paying attention to product market fit, what makes us different, what's going to give us our moat, etc. And and oddly enough, it just all seems to be coming back to data again, right? Because it's like now, okay, well, if fine tuning gives you that differentiator, well, that means you need to have some data to do your fine tuning with, right? And so anyway, just an interesting observation that we've started to make recently.
Yeah, I mean, it's all about vertical AI agents, and that requires specialization,
Yeah.
fine tuning. And if there's like investors on the West Coast, they are promoting or sponsoring investments in the AI agent type of products or the platforms. So I think it makes sense to reduce the cost for fine tuning so that people can produce the vertical AI agents targeted to specific industry subsector.
Yeah.
That's the reason Microsoft spending much time. Data center, right?
Right.
The NVIDIA, the collaboration.
Correct.
Computing.
Yep. Sure.
Very cool. Thank you.
Sorry.
Yeah.
Thank you. So, like in future, future outcome of those basically systems, like federated learning, basically, that basically the data is modules are trained locally, so that they don't need to share their raw data, which is sensitive, and that basically local trained modules basically hides that sensitive information, and basically it can be used to deal with the decision making systems or any other system, so that any changes in the fuel systems comes up, so automatically these modules locally train data without sharing the raw data, grow up day by day, and we can use that federated learning techniques to more protect those data. Apart from that, in case of standardizations, we can create the new frameworks, universal frameworks are coming up slowly. So these frameworks basically help us to reduce the efforts while dealing with the different data systems. Like blockchain technology, like we have concern with majorly concerned with the security of the system. So blockchain basically techniques basically with the AI basically providing giving more secure way, so that when in blockchain technology like a different transactions are clubbed inside of the one block, and these blocks are scattered across the network, so that there is no centralization and leak of the data from one system or anything. So more protections are there, and AI can manage this block, creating the block, handling those blockchain technology, so that we can create the temper-proof data in the bigger complex systems. So that kind of technology techniques we can is nowadays is more popular with AI. Apart from that, in future, reducing the operational efficiency and cost, basically, the predictive analytics which AI is supporting. So based on the AI, this is more nowadays popular, and that can basically help to like complete the patient's need or banking sector customers' needs while transforming the data, so that the delivery is more faster, accurate, and timely. We get to do those delivery. So these kind of like upcoming like technologies or scenarios are beneficial, like doing the transferring the sharing the data.
Very cool.
Um, Overall, overall, like I can feel that like with AI or APIs we can use or microservices we can use to share the data, and which we can create like a more faster, easier, and accurate kind of sharing system, which can benefit to the patient and the customer also. Like in case of like a safe, basically transferring the safe data. So the latest technology techniques like blockchain or like federated learning we can use, and then based on that, basically the systems can be built, robust systems can be built to protect those data. Like advancement, whatever the current advancement, what are coming into the AI or Microsoft services side, basically definitely it will help to create more protective, secure data, and those innovations basically definitely will help to the patients and the customers in the different sectors, including healthcare and the banking. So I believe that like using the AIs, microservices, APIs while dealing with the transmitting the data between the different systems definitely beneficial.
Very nice. Thank you. That's I think what, and so is this something that your company focuses on, or
Yes, currently means we are more using because currently we are dealing with the different organizations with this data, and we are building those AI based plus
the machine learning models?
Yeah. So modules currently to deal with those issues because currently the company has the legacy system.
Yeah.
So they are coming up with the new system to use those.
I think, but one of the things I've noticed is that a lot of people don't realize in these newer modern, what we call modern AI systems, Gen AI, how much machine learning is still underneath. Like, because it's not like an app, it's a platform.
Right.
It's a platform that makes up ChatGPT, right? And they may hit 10 machine learning models before you even send the prompt, right? Like, is this dangerous? Is it this, that? So, I just wanted to point that out because I do think people will start to realize this more and more that that to really make the magic happen, you need those discriminative ML models helping the Gen AI underneath the scenes, right? And when you put all that together, and that's why I was so excited to see Build this year, because now Microsoft giving us the developing tools, we could put those things together and build the solution, right? That might be 5 machine learning models, 3 3 generative models, one of them running locally, one of them in Foundry in the cloud. I can even see them calling out to other cloud networks. For example, Oracle. Maybe you're integrating with the hospital that's using Cerner. So you have to reach out to Oracle or something. So that's a part why I was just so thankful to have you make the trip, and thank you for coming all the way down here. And it's a really important topic, so I really appreciate it. And you're as we tell everybody everybody that comes and speaks at our monthly meetup, they have an open invitation to speak at any of our conferences or our events. So we'll make sure we keep you posted on those. And with that, I'll stop the live stream, and then we can just have casual conversation. I'm going to start to pick up. And just remember, we've got about 14 minutes. We want to exit right at 7.